Feeling unhappy, sad or depressed can occur at any point in someone's life, and none of us are immune to experiencing this. About 1 in 8 men report experiencing depression, but in reality it's likely to be a whole lot more common than that. These feelings can be enough to send you into a downward health spiral if you don't have the tools to deal with them. So, just like you would with pain and injury or physical illness, it's important that you deal with feeling negative and low as quickly as you can, so that it doesn't get worse and begin to impact upon your work, family and social life. I'm a clinical psychologist, and I expect many men will choose not to come and see someone like me because they don't see themselves as having a mental health problem. What a lot of people don't realise is that psychologists and counsellors don't only see people with severe mental health problems, but they can also see people who are just not feeling themselves or feel like they're just not getting what they want out of their life. There are lots of practical strategies that someone with training like me can work with you to build into your life, and there is lots and lots of research to show that these strategies really do work. So what are the classic symptoms of depression? It can be difficult to identify the warning signs of depression, particularly for guys like you who have very physical jobs, work long hours, and perhaps aren't used to talking about their feelings. But some of the things that you need to watch out for include difficulty sleeping or changes in your sleep patterns, feeling tired or fatigued, an increase or decrease in your appetite and therefore weight, mood swings with irritability and frustration, frequent arguments or loss of temper, finding it hard to take criticism, low self-image or loss of self-esteem, the general feeling of unhappiness and crying, loss of interest in sex or intimacy, a lack of concentration and not being able to think clearly, a loss of interest in your friends or activities that you've previously enjoyed, social withdrawal, and having thoughts about wanting to end your life. So what do you do to make yourself feel better when you're feeling down, unhappy or depressed? Well, regular physical activity, ensuring you eat a healthy diet rich in fruit and vegetables, low in processed foods, and drinking alcohol only in moderation are certainly a good start. In fact, research has shown that half of all cases of mild to moderate depression can be cured through exercise alone, so don't underestimate the power of a good walk a few times a week. Farm life can be isolating, but when you're feeling down, even though you probably won't feel like it, it's more important than ever to make sure that you keep in contact with others. Ring or make the effort to meet up with a friend, and most importantly, talk through your issues. This won't only help you, but it will also help them talk through the issues and problems that they might be dealing with. Having things to look forward to is also important. Although farms can be difficult to get away from, ensuring that you make arrangements so that you can celebrate special events and take breaks away will help your mental health. If you're at a loss of what to do, perhaps help someone who you know you could do with a hand, or offer to volunteer at a community event. Thinking about something different and helping others is likely to make you feel better about yourself. There are also some useful apps which are available, which will be listed at the end of this video, which you may want to consider trying, along with the simple steps that I've already talked about. It's important to note that not all depression can be handled with self-management. If you are deeper in that health spiral, you may need professional help. So, if you feel unhappy for more than a few weeks, or ever think about harming yourself, it's very important that you talk to your doctor as soon as possible. They'll be able to connect you up with the confidential support that you need. Remember, the sooner you see them, the easier it will be for them to help you. Clinical depression is an illness just like diabetes or heart disease. It can be successfully treated, but you must go to the doctor. It isn't wise or necessary to try to battle on for long periods on your own.